Hello, and thank you for joining us today at Phoenix Behavioral Health Therapy Chat. And my name is Dr. Dawn Parks, and we have Christine DesLauriers, who is joining us today, LICSW and addiction specialist. And first of all, we'd like to both wish you happy holidays, happy New Year. Today, we're going to talk about considerations regarding making a first therapy appointment. Can be really difficult, especially if this is the first time. How do I find someone? What's the intake session like? And sometimes just that anxiety of not being quite sure can prevent a person from actually taking the next step, which is seeking therapy. And we're also going to look at those people who perhaps were in therapy years ago and now they're coming back after 5-10 years or so. That can be difficult too. So let's start with what would bring someone to considering the thought of engaging in therapy in the first place.
Well, I think there can be a couple of reasons people would come for therapy. Sometimes it's to work on some specific goals that they have in mind. Other times it's usually prompted by some sort of life event, maybe a crisis, experiencing potentially a loss, moving to a different stage in life, maybe an adjustment with job or perhaps a marital separation, something that has made them feel very much that they need to talk to someone. They feel a little bit destabilized. So there can be a variety, really, of reasons to come in for therapy.
We are going to go through a few points to consider, and I think one of those is perhaps having an idea of might be any of those things that you just said. It might also be, I'm not sure. I think I just feel like I want to talk to someone. But, if there are any specific goals that, you may have in mind, sharing them with your therapist. Step one is calling up to make an appointment. And typically, now with COVID, a lot of places have long wait times. Other places, they do take clients relatively quickly, sometimes within the week. What you will be asked, typically before you even come into session, is, how did you find out about us? Basic demographics, name, where you live, your address, your insurance information, and that's an important thing to check on. Of course, most places will take the more common insurances, might be like Blue Cross or Tufts or Harvard Pilgrim, or quite a few others. But making sure that the place that you're calling takes your insurance. And if they don't, there is an option of self-pay as well. Some people prefer to do self-pay. And you may be asked how you found out about the place that you're calling. You may be asked, what is the underlying issue. It's not a time to be detailed about it, but it may just be, I'm feeling a little anxious lately. Just something, a one-line description. And then you'll be set up with an appointment for your first intake session. intake session. So the intake session, there's a lot of questions, and it's an important part of your therapy because your therapist needs to gather as much information as they can in order to work better with you and understand you better. So if there's a history of prior therapy, if there is anything that happened as far as traumas, childhood to adult traumas, you may be asked whether you take any medications. You may be asked about family relationships, what your support systems are, what your expectations are about therapy too. So it's typically a lot of questions on the part of the therapist, and I don't know if you found that with your intake clients, but I know with my intake clients, if it's a first time session, they're not sure whether it's always going to be like this or not. All these questions, I always make it clear this is the first session, there's all these questions, we have to get the intake information done, but we do make time to talk in the first session too. But moving forward from that, we actually talk. We have a good conversation. But it is important. So red flag really, if you go for an intake appointment and no one asks you those questions, that's a lot of important information that they could be missing.
Yeah, if you think of going to therapy the same way you think of going to a doctor, and probably the same process is involved. Generally you might check with your insurance company to see what doctors in the area accept your insurance. So you would do the same thing for a therapist if you wanted to go the first time. You might also look kind of geographically what's close to you. And you also may take references from friends and people who know of a good doctor also might know of a good therapist. So that sort of same process. And when you go in to see a doctor, he will ask you a lot of sort of biological family history. What substances are you using? What and if there is a substance abuse problem, maybe take a substance abuse history. Also take a little bit of medical, biological, get a little idea of the family dynamics that are going on for you. Because all of those things in terms of assessing your level of stress, assessing what is going on in your life are very relevant, and you need to sort of have a foundation of that in order to build on in the therapy. And the same thing for the doctor. He needs a foundation in order to be able to prescribe a medicine for you or to treat you. A therapist needs a similar type of foundation in order to build on that and to be able to help you with your anxiety or your depression or whatever is bringing you to therapy.
Right. So it is really important that we have this honesty between therapist and client. Sometimes it may be hard to talk about certain things, but the therapist is not there to be judgmental. And the more honest you are with whatever the issue, the more likely you are to be able to work together to move in a direction of addressing that. But if you're not, if, for example, do you drink, right? And I only drink 2 drinks a week, but in reality I'm drinking 22 drinks a week, right? But your therapist is not going to be able to help with that because they don't know that. So it's really important to be very clear and very honest about that. Also, expectations about therapy are important, and oftentimes, a therapist at intake will say to you, what are you looking for? What are you expecting? And if you can be honest with those expectations, I'm thinking of perhaps 4 sessions to treat this, and then I'm hoping that I'll be okay. Is that a realistic expectation or not? There are certain cases where it may be 4 to 6 sessions. It could be, sometimes a person presents at therapy for something that is fairly easily addressable. But other times when we're talking about a process, it might go for months or it might go for years, depending on what it is and the severity, complexity of what it is. So if you don't express those expectations, you can be setting yourself up to be very disappointed or angry. So another important point to make then.
I think you can also reevaluate too. You could say to yourself, look, I'm going to engage in 10 sessions, and I'm going to see where I'm at the end of 10 sessions. And if I'm feeling a whole lot better and I feel like the problem's resolved, then I can end therapy. If I still feel like I'm struggling, or if I identify more things that I need to want to work on, you can extend it for another 10 sessions. I think, the goal of therapy should be to support you to get to a place that you want to be at, that you've identified, get you feeling better. And when you do, I think naturally you are going to like fly from the nest, so to speak. You're going to go on your own, and that's a testament not just to the therapy, but to the person and how hard they've worked and what they've done, and that should be the goal of therapy. And that doesn't mean you can't come back. People oftentimes will come to therapy for a period of time, get to a good place, end therapy, and then a few months or a few years later, or even several years later, some life event has happened, and they feel the need to come back, and that's okay. You come back and you kind of get a tune-up, so to speak, and take care of whatever the current problem is.
Other expectations can be that when I go into therapy, I'm going to feel great. And therapy is not always easy, and often difficult feelings can come up. So I end up not feeling as great as I was hoping, at least, certain sessions or for a few sessions, because I'm working through something. So feeling a little more emotional or fatigued is not as comfortable, but it also is an important part of working through therapy. So, keeping that in mind, and keeping in mind how you respond to your sessions of therapy. You might want to try to book therapy on a day off if you need time to process, It's just a consideration. You may, before you go to therapy, need some kind of a quiet time before you actually go in to kind of emotionally prepare as well. And it may be that after therapy you just want quiet time for yourself, go for a walk, or just to have some space. So knowing how you're responding to it is really important too. So this is a two-way street, right? It's a teamwork. So to get the best out of therapy, we're working together. We're both working, and certain times difficult feelings might come up, and certain times you may not like your therapist. May not be a good fit. But we want to be sure, though, we want to give it enough time. To say it's not a good fit after seeing the person perhaps once or twice is a little fast. and we have to be sure that we say, no, we don't get on with the therapist. Is it because they are bringing up things that we're uncomfortable with, right?
Yeah, and things that you don't want to face.
Yeah.
I find for myself, especially when I work with people with substance abuse issues, I'll often ask them to try to cut back, at least if not eliminate their drink or drug of choice, because I need to be able to have them fully engaged in therapy, which you can't be if you're altered in some way, and also for other important issues like level of depression, level of anxiety, substances affect that. I can't get a clear reading of the level of depression or anxiety if they're consuming drugs which alter that. But when I find if I request that, at least to say try, people often sometimes they don't want to come back to therapy, they don't want to deal with that, they don't want to stop doing what they're doing, and they just want to focus on the depression. They don't want to focus on, well, I'm drinking every day of the week and how that's impacting my depression, because I don't want to change that. So they might say my therapist isn't a good fit, when really it's I don't want to really work on these things.
Yeah. And another thing that comes to mind is someone who may be very good, perhaps at emotionally kind of avoiding difficulties by perhaps getting very upset or angry or crying, and so now they're in therapy and this is not going to have an impact on the therapist, so they'll say therapy doesn't work, I don't like the therapist, right? But what is happening is they're being given an opportunity to change some of those behaviors there, right? Now whether they're ready to do that or not, it depends on those stages of change, right? But it could be that an opportunity to start to do that is there. So it's important as a client coming in that that client is able to share their feelings with the therapist and say, no, I'm feeling really angry right now, and I'm angry at you right now. Or I don't think I'm making any progress, or to be able to ask those questions, right? Because then they can be addressed, and it may be that the therapist says, perhaps I can help you to find someone else who would be a better match, right? Or it could be that working together you resolve the problem, the issue, and then you move forward, and the person is very engaged, throughout. So
I think it's important too for clients to understand that it's okay to be angry with your therapist. It's okay. And it's actually preferable that you come in and you say, I just am not happy with what we talked about last week, and I'm kind of mad at you at what you brought up, and process it in the session rather than just drop out of therapy and disappear. It can be educative, not just for the client, but also for the therapist too.
Yes.
And it can be a good healing process and a good way to go on, or you can mutually decide to go different ways, and as you said, refer to another therapist, another place, if things are not repairable in some way.
And that point is really important, that after therapy, after the 50-minute, 1-hour session, it's so important that the client makes time to process, reflect. What did we talk about? Why am I feeling so uncomfortable? Or whatever I'm feeling, what's generating that? What's going on? That processing and that ability to reflect on what's happened is really essential. In session, we're connecting, which is really important, and we're communicating. But the big change is happening in that period of time between sessions. So it's so important for the client to say, what was the purpose of that session? Now I'm going to apply what we've talked about. It may be something as basic as being able to say no, or setting boundaries, right? Well, yes, we've talked about it, and I have a lot of information. I know, I understand what we've talked about in setting boundaries. But the only place that change will happen is in my application of those skills and abilities. So it's kind of like homework, right? So that's what I'm trying on a day-to-day basis. And then when we meet at the next session, that's when we discuss, and we start to really become engaged in that. So
and I was going to say, too, that, it's important to realize that your therapist is human, too. And I'm thinking particularly of the example of people who've had a lot of trauma, and they come in and they start to talk about the trauma, and maybe the therapist goes forward with that a little bit, maybe too fast sometimes, or maybe not realizing that it's a little too fast for the client, and the client can get very triggered by that, very upset by that. It's important for the client to let the therapist know, wait a minute, this is a little bit too much for me, because sometimes it's hard to gauge that, and we in session the client might be giving signals that it's okay to talk about it, but really they're feeling I'm too overwhelmed, but that it's not getting communicated.
True. And also for the client to, first of all, give themselves credit for coming in and engaging, because it's not. It's a hard step to do. It's not necessarily an easy process. It can be very difficult for a lot of people. But also remembering that that change does take time, right? So we don't want to be in a situation where the client says, well, I'm presenting for this issue. Why am I not doing better? And it's only been a month, right? Sometimes we're looking at very easy to solve basic situations, but other times we're talking about years and years of habitual responses, of habitual habits, behaviors. And they take a long time to start to move in another direction. So being patient with yourself as far as progress, and again communicating that to your therapist, saying, do you think I'm on track? I don't feel like I've made any progress, or perhaps I have and I'm not seeing it, So again, having that open communication with the person that you're working with is so important. Yeah.
And I think too, when you are going to end therapy, it's important to go through the termination process, which is not just leaving and dropping out, but really deciding on a mutual termination time and preparing for that, and leaving in a good way, which sometimes for some clients that's the first time they've actually had that kind of positive termination process in their relationships in general.
It is, yeah. So again, keeping the that flow, that communication, and it may be that you're meeting. Typically, a therapy starts with once a week. It may be, if a person is really having a hard time, going through something very challenging, it may be twice a week for a while. But after a little while, it may drop down to every other week. It may drop down to once a month. But again, having that comfort level of saying to your therapist, I think I'm doing a lot better now. What do you think if we do every other week? And you may say, yeah, that sounds great, And then, as you said, as we're terminating, it's a process too, as a process of closure and getting to that point. Whereas we don't just want to stop. Unfortunately, sometimes I'll see clients who've said, well, I've had 7, 8 therapists, but I dropped out of all of them. Why? Oftentimes it's because when that important issue was brought up, it was either brought up too fast or brought up at the wrong time, or the client didn't feel comfortable enough to be able to say, can you slow down a little bit, and so now this is a habit, this is my way. I just, if things get too stressful, I just disappear, right? But now we have that information, and if the therapist has that information, they can work a little more with the client to help them get through that. Good place to find a therapist if anyone is thinking of engaging in therapy is psychologytoday.com. And if you look on Psychology Today, you will be able to see all of the therapists in your area, and you'll be given their phone number, their email address. You can see what insurances they take. Most of them will have a picture too, and a little write-up about what they do and their training and their areas of specialization. It's a really good place to start. The phone number's right there. You can call, and you can ask questions about therapists, right? You may want to come in for a consultation, or phone consultation, or a 30-minute appointment. So as we're coming to a close for this session, if you have any questions about what we talked about today, about finding a therapist, setting up with a therapist, whether it's individual or couples, or marriage counseling, family counseling, you could contact us at drparks@phoenixinfo.online, or call us at 508-623-3931. And if you have any issues that you would like to hear us discuss, you could also contact us at either that email or the phone number. And again, happy holidays.
Happy holidays.
Thank you, and we'll see you next week.